affects more than just a person who's addicted. It's one that affects the entire family.
Here now to talk about ways to stop the opioid epidemic and actually talk about an event that's going to be coming up this Friday to do so. Dr. Michael Miller and the Executive Director of Safe Communities Madison, Dane County, that being Cheryl Wittke. Good morning to both of you.
Good morning.
Hi. Dr. Miller, in your career, have you seen anything that compares with what we're seeing right now as it relates to the opioid epidemic?
Well, there have been a lot of different epidemics. Addiction's been around for all of human history. Certainly there was cocaine and in the very beginning of the 20th century, opium in the late 19th century, big cocaine epidemic in the 80s in America. The difference about this one is the lethality, and the lethality right now is coming from synthetic opioids, the fentanyl derivatives, and so it's just shot up. The deaths so far exceed auto deaths now, and so that's what's grabbed everybody's attention is the mortality, and people just experimenting who don't even have addiction can die from a one-time use of something that's very potent.
Cheryl, from the treatment side of this, I mean, how do you experience firsthand how this not only does affect the one person who might be using and hooked on these terrible drugs, but an entire unit, entire family, and then friends? I mean, this probably extends on and on and on.
Well, it is, and we're delighted to, co-host this event with the Wisconsin Medical Society Foundation and the Wisconsin Book Festival and the Parent Addiction Network. It's a group of families that have been affected by this locally, and they're using really David Sheff's books to sort of work through their issues and also to identify strategies that we can come together around.
Do you see that often? Like, is it in every case scenario where this is not just affecting one person?
Absolutely. And the roller coaster ride that he talks about in his book is one that families are experiencing every day.
So, Dr. Miller, we just reported earlier this week, I think it was, on how the Surgeon General is now recommending that anyone who knows somebody who's either an addict or somebody who's experimenting with this to carry naloxone. Is something like that, there's a cost associated with that, I know, and the Narcan is expensive. I guess, is this the right way to approach this?
Actually, Narcan didn't used to be expensive, and the manufacturers really raised the prices, and a lot of people are very concerned about what they've done. But Narcan is available now. It used to be only in emergency rooms and ICUs. Then it went to first responders, but now the general public is encouraged to have it. And it is a good thing because death is irreversible. But these overdoses are reversible before someone dies. And so I applaud the Surgeon General. He's been very open about this being in his family as well. This is one of many approaches. I think getting upstream is better. Having good treatment for addiction, such as we offer where I work, which is Rogers Hospital in Oconomowoc. New Start, where I used to work, right up the street here from the studios. And there are many clinics around town that offer excellent treatment. One of the things that Mr. Sheff points out, however, is that addiction treatment in the United States needs to be beefed up quite a bit. The quality needs to be improved, as well as the availability, and including medications in the plan is part of that. And so, again, Narcan doesn't treat addiction. Narcan only reverses an overdose.
And we want to make sure people know about this event. We've been mentioning David Sheff. He is a author, a New York Times bestseller author. He's going to talk about his experiences with opioid with his family, and that will be done at noon over at Madison Public Library. Adam's going to be moderating that discussion, and then again at 8 p.m. Friday night at the Monona Terrace. We thank you both for joining us this morning.
Thank you.
Thanks for being an MC for this and helping promote this important message, David.
It really is such an important topic.
Adam,
we can't talk about it enough on this, so thank you for doing what you do. We're happy to keep that conversation going however we can.
Absolutely.
Thanks, Adam and Danica. Appreciate it.
Of course. Thank you. 6:20 right now.